Greetings to everyone. I'm Dr. Madhumitha, pediatric dentist. So the topic we're going to discuss today is child abuse and neglect. It is a global issue. So we as a healthcare professional, what we can do to attend or care for these children is what we're going to discuss today. The contents of this lecture includes history, definition, prevalence, forms of abuse and indicators, forms of neglect, the role of a dentist in child abuse and neglect, and prevention and management. So moving on to the history, the very first documented case of child abuse was the case of Mary Ellen Wilson. She was a 10-year-old child who underwent a lot of severe physical abuse. The plight of this child was brought to a daylight by a missionary. Back in those days, there were no child protection law, but this case has brought the child abuse and neglect to the global scenario. So after this, many nations brought in child protection laws. So the word child abuse and neglect was coined by McLean. According to World Health Organization, it is defined as all forms of physical and emotional ill treatment, sexual abuse, neglect and exploitation that results in actual or potential harm to the child's health, development and dignity. Forms of child abuse and neglect. It is classified as follows. Child abuse can be physical, emotional, sexual and neglect, and child neglect is further classified into physical, emotional, educational, health and nutritional. Along with these types of child abuse and neglect, we are going to discuss few syndromes. It is battered child syndrome, shaken baby syndrome, Munchausen syndrome and Munchausen syndrome by proxy. Prevalence in India. Child abuse and neglect are global issues with devastating consequences both physically and psychologically for a child. According to UNICEF, the Indian children population accounts to about 19%, and as you can see in this world map, the plight of Indian children is in a very difficult situation in regards to abuse. The prevalence of forms of abuses, as you can see in the graph, the Indian child abuse average is way higher compared to that of the global average. The risk factors. What could be the situations or the factors that has led to the child abuse? The first one, dealing with the parental factors. It can be the violence, poverty or abuse the parent has undergone themselves or socially isolated, low self-esteem and problem of divorce. The child may be an unplanned child or one among many number of siblings, child's nature and if they are physically handicapped. Next is the environmental factors. It will include the chronic stress, political upheaval, unemployment, poor housing, alcoholism and drug addiction. So these all might lead to child abuse and neglect. So first we are going to discuss about child abuse, the various forms and the indicators of child abuse. First one is physical abuse. Any act which results in non-accidental trauma or physical injury, it is usually caused by hitting, shaking and suffocating, unreasonable punishment and hurting the child with different objects. The characteristics of the abuser, usually the abuser is the parent. One parent will be an active batterer while the other parent will be a passive observer. So next is the characteristics of an abused child. The child will usually be scared or get easily afraid of anything or remain a passive child. There might be some developmental delays and speech delays. Then there might be multiple injuries seen in the child and undernourishment might also be evident. Indicators of physical abuse. The first one is the injury history. Usually in these cases, the history will not coincide with the symptoms present. And then there might be some unexplained burns, bruises, lacerations and abrasions evident in the child. And next is the injury unusual for a specific age group, that is fractures in an infant. A child who has not even started moving or crawling yet will not be subjected to any kind of fracture. So that it means that it is a red flag. Next is the pattern. The multiple injuries in different stages of healing will be evident. That is, the child would have been subjected to many injuries or abused physically during a long period of time. So each injury will be in a different stage of healing. Next is specific bruising patterns. The pattern bruising can be either belt marks, finger imprints, cigar burns, rope mark, bite marks, or wire loop marks. And there's something called as glove or stocking burn injury. That is, a child's feet would be immersed in hot water, so this will give you an appearance of stockings or socks. So one screening tool I would like to introduce to you all is called 10-4-phase SP. It's a mnemonic and it stands for 10 is trunk, ears and neck. A child younger than 4 years, we should check for these or any injuries in this region. And next is faces, that is, it includes the frenulum, auricular region, then the cheeks, eyes and sclera. So as you can see, I have given you the two pictures. That is, the first one shows the bite marks, and the second picture indicates a physical injury wherein the child was lashed with a pen. Next is the emotional abuse. Emotional abuse can be defined as systematic tearing down of another human being. It attacks the child's psyche and self-concept. The reason, or rather the types, can be because the child has undergone rejection, ignoring a child, terrorizing a child, and then isolating and corrupting a child. The indicators of emotional abuse, the physical indicators include the habit disorders, which includes sucking, biting and rocking. Next, neurotic traits includes the sleep disorders, speech disorders and inhibition of play. The emotional indicators include poor self-esteem, which leads to insecurity in a child, destructive behavior, angry acts, withdrawal from the society, poor development of basic skills, alcohol or drug abuse, and difficulty in forming relationships. So next is sexual abuse. Sexual abuse can be defined as any misuse of a child for sexual pleasure or gratification. Children have unusual sexual knowledge. It affects child both physically and emotionally. The indicators: bruises or bleeding from the external genitalia, difficulty in sitting or walking, sexually transmitted disease, pregnancy in early adolescence, and any signs of forced oral sex. This could be the indicators. So far we have dealt with the child abuse and the indicators. Now we are going to learn about the child neglect. Neglect is not attending to the basic need of a child, which includes the food, clothing, shelter, education and overall well-being of a child is being neglected here. First one is the physical neglect. Extreme delay in seeking necessary health care, child abandonment and inadequate supervision of a child, rejection of a child leading to expulsion from the home, and failing to adequately provide for a child's safety, physical and emotional needs. This on the whole may lead to malnutrition, serious illnesses in a child, physical harm, and emotionally the child might be feeling low self-esteem. Next is the educational neglect. A child being not enrolled in a school will lead to deprivation of education, which in turn might lead to underachievement of the child, and the child might be deprived of the basic skills necessary for the life. So dropping out of school might lead to continual disruptive behavior that could be seen in a child. Next is the emotional neglect. Refusal or failure to provide needed psychological care for the child, and constant belittling and withholding of affection might lead to is considered as emotional neglect. So next is the nutritional neglect. As you can see, this is a case of a 8-month-old child. Here the first picture depicts a child who is severely undernourished. But the same child, when given proper nourishment, this is how the child looks as in the second picture. So caring nutritionally is very important. What are all the characteristics of nutritional neglect? It includes a child who is begging for or stealing food. The child is frequently hungry, rummaging through garbage pails for food, then gorging self and eating in large gulps, then hoarding food. And not only giving improper food to the child is considered as a neglect, but even overeating or allowing a child to overeat, which might lead to obesity, is also considered as nutritional neglect. Next is the healthcare neglect. It can be either medical or dental, and focusing on dental neglect, it is willful failure of a parent or guardian to seek and follow through with treatment necessary to ensure a level of oral health essential for adequate function and freedom from pain and infection. So as you can see in the picture, this is rampant caries, and not only rampant caries but early childhood caries due to unawareness of a parent is considered as a neglect. Usually this kind of neglect may cause the child pain, infection, and then some speech delays, and consequently there might be some dental problems. So having discussed about the child abuse and neglect, we are going into the syndromes. First one is the battered child syndrome. This term was given by Kemp in 1962. It is defined as collection of injuries sustained by a child because of repeated mistreatment or beating. The characteristics of battered child syndrome include severe physical abuse, intentional trauma, or unreasonably more severe bruises is evident in a child. It can be laceration, burns, and fractures usually are common in these children. Then it's well hidden by its perpetrators. No correlation of history and the symptom in a child is evident, and multiple injuries at different stages of healing will be seen in the child. So next is the shaken baby syndrome, also known as the shaken impact syndrome. Here this term was given by Good-Kelch in 1971. Here usually the child is less than 18 months of age. So what happens is that when a baby is shaken, the underdeveloped neck muscles, because of the underdeveloped neck muscles, the head shakes to and fro, and the brain inside will be hitting the skull in the front and the back, which will rupture the veins and lead to cranial hemorrhage. So the triad key factors which is important is retinal hemorrhage, and next is the subdural or subarachnoid hematomas and encephalopathy. The investigations that we might ask them to take if we doubt of child abuse, we can ask them to take CT scan or X-rays. As you can see in the image, the CT scan, there is a subdural hemorrhage. The radiolucency between the skull and the brain indicates the hemorrhage. And next, the other characteristics evident in this syndrome is absence of other external signs of abuse, breathing difficulties, severe intracranial injury, seizures, and unconsciousness, and sometimes it might lead to death. Next is the Munchausen syndrome. Here this term was given by British psychiatrist Richard Asher. Munchausen syndrome is defined as the intentional production of feigning of physical or psychological signs or symptoms for the purpose of assuming the sick role. The main cause behind this is psychological need for attention, sympathy, or care. Next we are going to discuss is Munchausen syndrome by proxy. It's also called as the medical child abuse. Moving on to the history of this syndrome. It was introduced in 1977 by British pediatric nephrologist Roy Meadow. Here he came across a sibling where the parent has inflicted the illness in one child by salt poisoning, and the same parent has fabricated the symptoms of the child's urine sample by including her blood into the sample. Okay, so as you understand this case, moving on to the definition, the intentional production or feigning of physical or psychological signs and symptoms in another person who is under the individual's care for the purpose of assuming the sick role by proxy. So basically, when the illness is fabricated on themselves, it is Munchausen syndrome, and if it is fabricated in someone under their care, it is called Munchausen syndrome by proxy. The indicators include the child victim, who is usually a newborn to 8 years of age. Illness is fabricated most commonly by the mother, and the father here is minimally involved in the child's life or health care. Next, the perpetrator usually remains calm when a major crisis occurs to a child. So what actually happens is the illness is fabricated by a parent. The parent denies knowledge of the etiology, and because of which the child is undergoing many number of investigations necessary. And one main characteristic of this syndrome is that when the child is secluded from the perpetrator, the illness decreases. So having discussed about the abuse, neglect and the syndromes, we are going to see the role of a dentist or how we can help these children. So why are we supposed to do it? It is on a humanitarian basis, and we work in close proximity to a child for a considerable amount of time when compared to other physicians. And next is frequent examination of orofacial region, legal and ethically, and we are also legally and ethically obligated to do this. So clinical assessment, what are we to do when we suspect a child abuse clinically? It is a mnemonic, 4R we have to remember. One, it is recognize, refer, record and report. First one is to recognize. How are we going to recognize such a child? One can be unusual dressing for the season. So let's say in a summer, child is wearing a full sleeve. This might be to cover the bruises in the child. And next is the general demeanor of the child and reaction to the others. Next is the parent behavior. Then gross physical examination need to be done from head to toe and check for extraoral and intraoral signs. And studies show that about 65 to 75% of child abuse case involves the head, neck or oral cavity. And as you can see in this image, 27% is seen in the temporal region, 20% seen in the oral cavity region, and other like 10% in the jaw. So we are actually have more chance to suspect these cases. Next is to refer. It is optional, and as a dentist, when in doubt, we can always refer to a pediatrician, gynecologist and psychiatrist. Reporting and documentation. What are we supposed to report? The name, age, sex, observational notes of the indicators, then sibling details should be recorded. So a proper history with the child's and parents' own words, physical examination, indicators that we have seen, then investigations which might be laboratory tests or radiographic evidences can be attached, then photograph. Reporting. To whom are we to report? One is emergency number, Indian emergency number 112, and next is the child helpline 1098, and next the Indian mobile app 112, then the website child or line organization. Next is to the police 100, we can dial up 100. One advantage of recent technology is that it is immediate response, it is connected nationwide and it is smartphone friendly, and voice call and SMS is supported and GPS and GIS enabled. So moving on to the prevention. So in India, Ministry of Women and Child Development usually takes care of the child helpline, and they also usually conduct many programs for strengthening families through counseling. And next is strengthening the dental professionals and auxiliaries with knowledge on reporting cases, and in United States there is even an organization for the same. It is called the PANDA, that is Prevent Abuse and Neglect Through Dental Awareness. Next is public awareness. Usually be it the dental professionals or the public usually hesitate in reporting such cases. So making them aware of the various laws, the child protection laws, could help and change the life of a child. So the judicial and reporting system includes POSCO law, the Child Labor Law, Child Marriage Act and Juvenile Justice Act. And through child education and school programs also we can prevent such scenarios. And there are many non-governmental organizations, as mentioned here, there are many non-governmental organizations that help children and do many school awareness programs. So I would like to conclude by saying that every child deserves safety, dignity and health. So not just treating teeth, but being vigilant and aware, we dentists can change a child's life. Thank you.